Welcome. Today's discussion is on mental health and mental illness, and I'm very pleased to have joining me in this discussion is Dr. Rajiv Tony Juneja, who is a practicing psychiatrist. Thank you, Dr. Juneja, for joining us.
Hi, Janet.
Dr. Juneja, could you please define for us the difference between mental health versus mental illness?
The way I like to think about mental health versus mental illness is how does one get through their day, right? Are they actually having major, say, symptoms, which we can talk about in a minute, but are they having something that really blocks them from getting through their day where they're productive at work or they're having, a fulfilling relationship? So, for example, if somebody, has to check their door 3 times before they leave in the morning, but then they can walk away after that 10-second ritual, not a huge problem. If they stand there for an hour, that's a different problem, right? So it's going to impact their work. It's going to impact how they function through the day. So it's really the severity of symptoms. So everybody gets blue. Everybody gets a little, sad at times. Now that's one level. But if somebody's not eating, in bed, with the shades closed and suicidal, that's a whole nother level. So I like to think of it as the severity. How severe are the symptoms that one is having?
So we're going from one end of the spectrum to what would be classified as normal. I'm having a very stressful day.
Right.
I have all this going on at work. I have these caregiving challenges. I'm trying to balance out my day and possibly the lives of others that I'm caring for. So, am I still mentally healthy?
That's right.
Or am I being confronted with a mental illness that I would need then support of others?
Right, and that's kind of the yellow and the red. Those are the yellow and the red flags. Which is if now you're not able to get through your day, kind of on some smooth, in some smooth way. That's at least a sign like, there's something going on here. I seem to have more anxiety than most people I know. What's going on with that? Clearly, sometimes symptoms are very obvious. Somebody has panic attacks, and a real panic attack. Usually, people end up in the emergency room. That level, some symptoms are more obvious. Other symptoms are much more, kind of undercover. Somebody may, really only have, 1 or 2 glasses a week of wine, and then all of a sudden they find themselves, they're drinking 3 nights a week, and then they're drinking 5 nights a week. So what's going on here? Something's changing. So anytime you see any kind of change in behavior, you want to think about, do I need to speak to somebody?
And when you, as a healthcare provider, a physician who is working with individuals every day addressing this, how common is it for people to step forward to say, I really need to talk about this? Because there is a stigma in our society today.
Absolutely.
If you are putting yourself out there that there may be a particular mental state that you're dealing with, that you need support, but what does that, am I going to be labeled in some way? And how do you address that kind of issue that's present?
You hit the nail on the head when you say really one of the major problems is the stigma attached with mental illness. Now keep in mind, there are biologically driven mental illnesses such as bipolar disorder. Right now, that is a real, a biologically driven psychiatric illness. It responds wonderfully to medications, but people, in general have a tough time, and families have a tough time with accepting somebody in their family might have a mental illness. And so it is really the stigma within the family, it's the stigma within the community, but the great news piece of it is that it's treatable. So depressions are treatable. So if somebody really has a major depressive disorder, somebody who is addicted to some illicit substance, if you get them in treatment, they do better. It's as simple as that.
It's identifying the signs and symptoms
immediately
up front and talking to someone like yourself
to
get some guidance because again, it can snowball in our minds and especially if you don't want your friends and your neighbors or your employer to know about that you may be confronted with some of these challenges in the way that you're thinking or processing your day.
Yes.
And so having the support and offering the variety of treatment that may be available out there
That's right.
would be holistically too you needing to address the
Right.
the
So you want to
family.
look at you want to look at all the different kinds of avenues that are leading to the problem. So like there's no magic pill that's going to fix somebody's marriage. So this is not going to happen that way. So you clearly have to work on what are the marital issues. So somebody that comes in with a depression and they're having marital problems. Just giving them medication isn't going to be enough. It might be a key piece of the treatment. But then, are they getting the extra support that they need?
So it could simply be addressing the stress, aside from dealing with the biological piece that would come along with mental illness.
Yes.
It's when we're dealing with the relationships or family issues or stress and job, it's really kind of walking this person or this family through a process and developing a plan of wellness that brings them to a state
That's right.
that of balance and feeling that they can manage.
Right. In fact, there's plenty of research that shows when stress levels are high, the body is actually driven out of balance, and that's really where disease or dis-ease, as I like to think of it, comes from. So people can have more cardiovascular disease or hypertension, and so because we all have these predispositions, it's just we all have various levels of predispositions, but stress starts to unmask them.
This is so
and
true.
it's very important to get the support to decrease your stress.
On a final note, Dr. Janesio, any final thoughts before we close out on confronting mental illness versus mental
Yeah, the thing I want your audience to know is some of the most successful people I know have therapists, go to see a psychiatrist if they're having some real, mental stresses. And it's about asking for help. And, it can be a very confidential relationship between you and your psychiatrist.
Help is available, and again, you are not alone.
That's right.
And
That's right.
professionals like yourself are ready to embrace
Absolutely.
and be there fully.
Absolutely. And if one doesn't find somebody they connect with first time around, go to somebody else.
Don't give up.
Don't give up.
On that note, for more information on mental health and mental illness, please log into our website at www.lastinglifestyles.net. Thank you.